Health alert. A new study reveals about 70 to 80% of women who were diagnosed with thyroid cancer had tumors removed that really didn't need to be or should not have been. The study focused on women from the U.S., France, Italy, and Australia in the years between 2003 and 2007. Dr. Ali Kazarian of Kazarian Urology joins us now here on the morning show. So there seems to be an overdiagnosis of thyroid cancers. Why?
So if you look at this is kind of a law of unintended consequences. So as we improve in our imaging and as people get imaging for other medical issues, and now we have ultrasound, we have CAT scans, we have MRI scans, we are finding more of these incidental, small, what end up being clinically insignificant thyroid nodules, the majority of which are benign. However, that prompts a biopsy, so you do a thing called a fine needle aspiration biopsy, very minimally invasive, ultrasound guided. However, 5% of those biopsied will end up being cancer. The majority, fortunately, are a papillary carcinoma, which is not as aggressive, it's not as rapid moving, and a lot of times it may not cause any symptoms, it may not enlarge, and it rarely causes death. Historically, men and women, and this majority, about three out of four women, younger ages, get a surgery to remove the thyroid, and that has unintended consequences because your thyroid, which is the center of your metabolism, now is gone, and so you have to be on lifelong medications, and sometimes you can't get the dosing right, so it has implications.
Yeah, it strikes me that you and I actually talked about things that are similar to this when it came to prostate cancer,
Absolutely.
that it was screening that was leading to maybe some surgeries that weren't necessary. When should the tumor be left alone, and when should you be more aggressive?
So it's actually very interesting. Around the same time where this article came out in the New England Journal of Medicine this week, the American Thyroid Association had released a statement that cited this guideline. So basically they recommend if you have a thyroid nodule that is less than 1 centimeter on the imaging appears to be confined to the thyroid, that may not need a biopsy. Active surveillance may be an alternative to the more standard immediate surgery, which is the standard of care for these lower risk tumors. And then secondary, or lastly, surgery and radioactive iodine, some of the more standard of care therapies, may be held to be more minimally invasive. For example, you can do a lobectomy, remove part of the thyroid, not the whole thyroid, and avoid radioactive iodine unless it's necessary, where the tumor may have spread a little bit within the neck to decrease recurrences and things of that nature.
All right, you're sitting there, the doctor sits down, has that concerned look and says, okay, we think there's a tumor, we think it may be thyroid cancer. What are the most essential questions that I need to ask as a patient?
One, I would recommend that you have a good team that you feel comfortable with. One, the surgeon should have experience in thyroid surgery and be mindful and ask the questions. You know, is this a tumor that we can monitor? Is this a tumor that we really need to go after? Because there are some dangerous thyroid cancers, medullary cancers, anaplastic cancers, which are more aggressive. They actually need to be addressed because they can cause problems. The other thing is see if you have any symptoms. If you have a lump in the neck, if you have pain in the neck, if you feel a swelling in the neck, have difficulty swallowing or breathing, you have a chronic cough that won't go away, make sure you address that and talk with your doctors, because then you actually need to be evaluated and make sure we're not missing anything that's significant. The other thing is think about power of a second opinion. You have time to go and ask someone that has some expertise in thyroid cancer and make sure that your questions are answered and that you are getting the treatment that you need when you need it for the disease that you need.
And you bring up a good point. Don't be afraid to ask for a second opinion.
Absolutely.
You're not going to offend your doctor.
I think, you know, we all welcome the idea of a second opinion because it allows for you to feel comfortable with what needs to be done, and you are talking to experts who deal with a specific disease. And one that, you know, we're criticized a lot for this supreme specialization within medicine today, but this allows for you to have a great answer from people that deal with the specific disease you are undergoing with expertise that the other doctor may not have.
Dr. Ali Kazarian, always a pleasure.
Thank you.
Kazarian Urology. If you missed any of this interview and you've got some concerns, some questions you want answered, you can watch it online on news4jax.com. It'll be posted on the morning show page probably after 10:30, 11 this morning.